Hey, everybody. Let me acknowledge that I'm being recorded, as all of you have to do too. All right. So this morning, quickly, we are going to cover a little bit misleading co-occurring mental health and substance use considerations for multi-system youth. We're not going to dive in deep. I should have said something fundamentally important during the recording stopped 2 seconds. So we did that in the spring, in several back-to-back ones, talking very specifically about considerations for youth with co-occurring mental health and substance use needs. Today, I want to tackle this more from the perspective of integration. And really our whole ECHO is it's an exercise in integration, and so really emphasizing that, and hopefully then also providing a lot of resources that if there are topics that you would like more information about, that there will be links to take you in that direction. So really that's kind of my direction today. And hopefully I will be a little bit less rambling than I have in the first 120 seconds, and we'll move out of this more quickly than in the 15-minute allotment. So the objectives that I hope to hit on, covering quickly, I want to describe MSY, SOC, COD, and some other acronyms, things that you might run into, and certainly that we run into here on a weekly basis. The middle and the two are the two in the middle are the big ones. In the consideration of overlapping and integrated needs, and expanding on that just a little bit, and the relationship between all of the topics, MSY, SOC approach, COD considerations, tying in our didactic from last week, dual diagnosis. Acknowledge that AOD, to throw in more acronyms, that's alcohol or drug use by youth, can be very frightening to address. And the frightening part of that is very understandable, but then it can also lead to some service difficulties. And then throughout, provide a lot of links. Hopefully, I think that this is the only, other than the title slide, this is the only semi-informational slide that doesn't have links associated with it. So starting, and this is not a coverage and a description of the MSY approach. It's a link to more information if you'd like more information about the MSY approach and consideration, but it's very much a part, obviously, of our SOC ECHO for MSY, that is System of Care ECHO for multi-system youth. The multi-system youth approach is an integrated approach. One of the primary driving factors in this MSY approach is the recognition that I'll bet you a lot of you have from experience, that too often youth with multiple areas of need in the system involvements that are very familiar to all of you on this ECHO, they have a lot of struggles for a lot of reasons. Obviously, that's kind of an understatement, right? But one of the primary driving reasons with MSY is that too often that children and youth in these situations are removed from parental or caregiver custody, placed into CPS custody or Child Protective Service custody. And among the reasons for this are not the direct abuse or neglect considerations that we think about primarily for CPS, but sometimes it's just so that the full range of treatment can be accessed because it's outside of what the parent or the caregiver can do for a whole host of reasons, financially being, on top of that. One of the driving purposes of this approach is defined in Ohio Administrative Code. If you're not familiar, it is in the Administrative Code. It's in Title 5101. that describes the purpose of the MSY approach. One of three that it outlines is to prevent parental relinquishment of custody to public children's service agencies solely for the purpose of the child obtaining needed treatment, because that doesn't serve anybody, most importantly, the child and the family. And so strategies around that, which are very integrated, focused. So a couple of links here, PSCAO, PCSAO. I can't get anything in the right order today. Several years ago, put out this information brief. It's a big one. It really discusses and presents and qualifies, really, and quantifies also the MSY approach. So the link is there for that. And then if you are having trouble sleeping, Ohio Administrative Code is always something to take a look at. And there's a link there for where it's described, at least financially, in Administrative Code. Part of our approach in this ECHO is that we are framed within a system of care approach. And a link here to, it's an understatement to say a really good article. This is by the system of care gurus themselves in kind of the status of where things are many years later. So system of care approach has been around for a long time and expanded. If you're not directly familiar with it, it's somewhat self-defining in the name, in system of care approach for children, youth, and families. It's a philosophy or approach that has evolved not too far from its origins, but evolved to address what was recognized and is unfortunately still the situation, insufficient care or choices, options for children, youth, and their families and young adults with multiple areas of need, in these multiple overlapping areas of need. And certainly in this, we see a lot of that integrated possibility. And we still struggle with that integrated possibility because, no single child serving system can be an expert in everything. And so the integrated approach involves a lot of communication. It involves a lot of cooperation. And it's easy, even when the best intentions are there, to maintain those cooperations, for that to fall off, because we all have our areas of focus and we all have time constraints and funding constraints and a lot of things that slow that down. But the more that we keep this in our sights, in our operating wheelhouse, the better the children, the families, the youth that we serve are going to be. So areas of overlapping need that are identified with system of care include mental of health. It's a good thing I'm not facilitating today, right? Mental health, substance use, biomedical services, social child welfare, education, juvenile justice, recreational, vocational, transitional, early childhood, all of these different areas of specialty within child serving systems that really we can do the best service when these work in cooperation and regular communication with each other. That's the system of care approach. So back to MSY, and whenever I say MSY, I think we're really trying to move away from identifying folks by the area of their needs. So we don't say depressed kids or autistic kids anymore. We say kids living with, and folks living with. So maybe someday we're going to change multi-system youth to youth with multi-system involvements and catch up with our own advocacy. But the areas involved with the multi-system youth approach, obviously children's services really leading the way in terms of the identified systems involved in this approach. Juvenile justice is considered here, developmental disabilities a part of this, and then the mental health and AOD serving systems for youth. You see how much of this is also captured in the system of care. So there's quite a bit of overlapping areas of integration here that we know are important. And the more that we can overlap and that we can really integrate in a cooperative way our approaches in serving children and youth and their families with these overlapping areas of need, the more we can communicate between, the more likely they are to have more successful outcomes. So now one component of that, to get back to the title of today, the co-occurring, one component of that captured in one of these dimensions, the mental health and AOD dimension, that's alcohol or drug, is a co-occurring approach, a co-occurring view. And this is mental health needs, substance use needs that can be identified independently of each other. That is, as we understand that there's something on the mental health side, or usually it's some things, it's plural, right? Very often, especially in our echo presentations, we see a lot of areas of possible mental health diagnoses, and there's so much overlap in there. The differential understanding is very complicated, and that's true even when substance use isn't involved. But as soon as substance use becomes involved, then the complications really expand, because is this a symptom of the substance use itself? Is this maybe exacerbated by the substance use? Is the substance use maybe hiding something? And so that really complicates our understanding of what's going on. But then the substance use, those areas of need can be identified independently. So we understand that there are something or some things going on the mental health side, some things, plural, on the substance use side that can be identified. But when we're considering them within a single individual, we can't consider those individually. We can't treat mental health on one side, substance use on the other side. We have to treat them in context of each other because they are mutually influencing. And so that is kind of a drill down to that really integrated approach. When I looked over these slides this morning and I saw this slide, I thought, boy, this looked a lot better in my head when I created it than when I came back to it. It doesn't make a whole lot of sense, does it? The intent here was to indicate that integration happens at different levels. We have a very big integrated view and approach from system service coordination on a system of care approach. That's refined just a little bit, but most of those components, or really all of those components, overlap when we think about the MSY approach. When we take one of those dimensions out of the MSY approach, the mental health and the AOD piece, then we have the mental health and the substance use co-occurring possibility. Not every youth has co-occurring needs. And there's a lot of similarity here. Last week, if you were with us, Dr. Harper talked about dual diagnostic considerations with mental illness and intellectual disabilities. And the overlap there and some of the integrated consideration there. And so this is very similar to that in terms of the integrated view. So at the Center for Innovative Practices, where I am, we have very specifically looked to consider and then disseminate best and promising practices for youth, adolescents with these co-occurring needs. And so we focused on this for quite a while. And initially we had it separated, mental health, substance use, and the overlap in between. And initially we had captured developmental trauma and trauma on the mental health side of things. Experience has taught us that developmental trauma and trauma are so significant, and I know for most of you that's just a ridiculous understatement, right? So significant that we can't capture that under an existing dimension, that it really has to have a dimensional consideration of its own. So our co-occurring consideration really becomes at least a tri-occurring consideration, or as we're moving to discuss it these days, really it's a multiply occurring approach. And so this ties into that integrated view. I'm not going to go into depth about that. We've talked about that before, and there's going to be links to that. The link here is for a fairly recent brief put out by Health Policy Institute of Ohio, talking about the prevalence of ACEs for Ohio youth and children. Whenever we talk about co-occurring considerations, the substance use piece typically is the one that pops out. There is not one area that's more important than another. Mental health is not more important than the substance use, is not more important than the trauma. Each of these areas is equally important to be considered on an equal basis, both individually, but then very importantly in terms of the mutually influencing ways that they interact. Substance use, though, has kind of some special situations in our consideration, in that it can be very frightening for a lot of providers to even consider, for a whole host of reasons. We won't go into those. But those hesitancies or those anxieties then can decrease the likelihood of regular screenings and assessments. You all know that if there are unaddressed areas in an individual, if those are hanging out there, that they're unrecognized and then they are unaddressed in the process, that it really decreases the likelihood of successful change. So the more that we can capture in terms of our recognition and then our collaborative recognition with those that we're working with, the better the odds that they're going to move in more successful and healthy trajectories. So really advocating strongly for regular, not just at intake, but regular screening for substance use very specifically, because substance use, when it's mixed in with youth and adolescents, greatly increases risks across the board, greatly increases, can exacerbate all of the symptoms of everything else that's going on. Potential for significant developmental impacts. When you add a psychoactive substance to the very active period of brain development during this period of life, the impact is lifelong. It alters the way the reinforcement pathways are being finalized. It alters the way that the inhibitory control is being finalized, and that has significant impacts moving forward. So the more that we can help a youth and a family decrease their substance use, the greater their odds moving into young adulthood and adulthood. Substance use can exacerbate the whole bunch, hide, obscure, and somewhat arguably, but substance use may represent the area that has the greatest area for individual conscious control in terms of impact, more so than trauma and mental health. So a great screening resource, the link here for the craft, I really recommend looking at that. I'm not going to talk about this. If you want to talk about this, there'll be a link on how to get a hold of me. I promised brevity and I'm not delivering. So for a greatly expanded view, very specific to youth living with co-occurring disorders and needs, we produced a series of trainings, webinars for the TA network in cooperation with SAMHSA. It's now housed at the University of Maryland. If you go to the YouTube channel, the link is here. Pretty specific, expanded explorations of youth with mental health and developmental trauma needs, and then specific to different areas, depression, anxiety, externalizing disorders, ADHD. The one that's circled there in red has just an excellent review by Dr. Balanci from Judge Baker Center at Harvard about psychotropic medication use and youth with high levels of need. It just does a fantastic job, which is really faint praise. So there's the link to that. And there's a link to me. If you do want any more information on this, I can just go on and on and on as I have demonstrated. But there's a way to contact me with questions, comments, if you'd like a little bit more information. So that's it. Thank you for your time.
That's great. Thanks, Mike. Lots of helpful information.